Today I'm going to be discussing Senecavirus A. The title says neonatal pigs. Most of the discussion is going to be infection in pregnant sows. We were hoping for a little bit more data in the neonatal pig department. And again, working with Fabio on these. So today I'll just breeze over most of what I have for background information, seeing as Dr. Deal covered most of that, and then give you some preliminary data from an experimentally infected pregnant gilts, pregnant sows, and then the results from their farrowed piglets, and some take-home messages from that. Again, this is mainly just background information. The one point, there was a question about strains and humans. In that phase 1 clinical trial, I would point out that there was a report of a adverse event where a human patient that was inoculated with Senecavirus died, and they only detected Senecavirus in the tumor and none of the other tissues in the body. So it seems like humans don't tend to have as widely disseminated infection if it occurs. And then they do develop neutralizing antibodies at pretty much the same scheme as pigs do, if you look at the human literature. Again, this is all just background here. Again, the concern for Senecavirus is not necessarily that it's killing pigs, it's that it's similar to the transboundary vesicular diseases. And from the USDA and kind of federal government perspective, it puts a pretty heavy burden on their federal investigations. Prior to 2015, there were usually less than 20 swine vesicular disease investigations, and in 2017 there was over 1,200. So you can see a pretty large increase in the amount of resources that this disease is consuming from a regulatory perspective. As far as neonatal pigs, first reports of Senecavirus affecting neonatal pigs is in 2014, 2015. Brazilian sow herds that had vesicular disease, they were experiencing what was termed epidemic transient neonatal loss, with piglets dying within the first week of life. And then subsequently, similar reports were followed through from infected U.S. herds. I just have some listed here to kind of give you an idea if you want to follow up on those. The reports on the disease in piglets is variable. I guess that's my takeaway. Is most commonly it's reported as piglets are lethargic, anorexic. They will have diarrhea, or occasionally it's just sudden death. Some of the reports out of Brazil do report some neurologic disease, kind of uncertain as to how common that is. U.S. reports haven't had that. Gross and histopath lesions, again, are really variable. Most often, there are no gross or histopathologic lesions in the affected animals. They can be dehydrated. That's a common item. There's been reports of edema in various tissues, including the mesocolon and subcutaneous tissues. And then piglets can get vesicular disease just like adult or mature animals. Some of the histologic lesions are, again, the relationship of Senecavirus to some of these is uncertain. There's been reports of villus tip epithelial degeneration, excessive vacuolation in transitional epithelial cells, some reports of interstitial pneumonia, and some inflammation in the brain and choroid plexus. Again, these are all from field cases, so it's uncertain what other factors may be in play. Most of them have had testing for other diseases. As far as epidemiological, most of these piglets that are affected are under 7 days of age. The sow herds are most commonly associated with vesicular disease in the adults, but not always. Some of the case reports where they went through 6 sow herds, the Iowa group reported that there were several sow herds where there was no vesicular disease, but yet you had piglets affected. And then the pre-weaning mortality can be very variable. At a herd level, most reports are between 20 and 30%, but within litter can be anywhere from 20 to over 100, again, or not over 100, over 50, with some entire litters being affected. So given the variability in these reports of natural disease and the fact that we can't control for a lot of factors in our field investigations, it just highlights the importance of kind of future investigations into Senecavirus in the pregnant sow and their neonatal pigs. So that leads into our experimental infection. The objectives here were to investigate the pathogenesis of Senecavirus in pregnant sows, looking at viremia, lesions, and clinical signs. We also wanted to determine the shedding pattern in these sows, looking at oral fluids, feces, and then milk or colostrum post-farrowing, and then evaluate those piglets. Again, the hope was that maybe we could recreate the fairly consistent piglet syndrome, looking at infection status, trying to assess whether or not they were infected in utero, and then follow them post-farrow for the first week of life, and then what their possible viral shedding, lesions, and clinical signs might be. So the virus that we use is Senecavirus isolate obtained in 2017. This is from a heat check bore on an affected sow farm in Minnesota. The isolation, as Dr. Deal pointed out, was performed in a highly permissive human lung cancer cell line using RPMI media. The titer we used for inoculation was 4 × 10⁶ TCID50 per mil, and it was a passage 5 virus. We had 7 sows, 5 were in the inoculated group, and 2 were in the control group. We used intranasal inoculation, so the SVA group had a total of 2.3 × 10⁷ TCID50. That was in 5 mils of media divided between the nostrils. And then our control group was sham inoculated with the same volume of the media. The SVA group ended up, inoculation occurred between 14 and 21 days pre-farrow, and then the control group was 20 days pre-farrow. As far as sampling, clinical samples were oral swabs, fecal or rectal swabs, and then serum. Those were collected at arrival, so that was 7 days pre-inoculation. And then we had 3, 7, 14, 21, and 28 days post-inoculation evaluation. And then the sows were euthanized and necropsied at 28 days post-inoculation. Piglet sampling, we had the same clinical samples here, oral swabs, fecal swabs, and serum from each piglet. They were then tested in pools based on litter, with the exception of serum, which on day 0 or when they were born, those were tested individually for the SVA group piglets. We also collected milk and an udder wipe from the sow. The udder wipe, I don't know if you're familiar with it, it's just using a gauze soaked in media and then swabbing the mammary chain, which would be kind of a surrogate for kind of like a family oral fluid sample. Piglet saliva would be there on the udder. And those samples were collected at birth, and then 1, 2, 3, 7 days post-farrow, and then we had some of our SVA group that made it out to 12 days post-farrow, but piglets were removed. 2 piglets per litter were euthanized and necropsied at all of those time points that I pointed out for the clinical samples. So I'll move on to the results. What this graphic is showing is going to be fairly representative of what the future sow ones here, so I'll explain it once. On the vertical axis, this is the cycle threshold or CT value at which the real-time PCR became positive. Our positive negative cutoff is CT36, so it's about right here. And then the groups, SVA group will be in blue, the control group is in orange, and I'll just give you a spoiler. The control group is going to stay at the bottom and you won't be able to see it really all the way along. And then above each of these, I have a percent, not really a percent, it's a ratio here, number positive or the number tested. So this is serum results. This is viremia, showing viremia. And this is fairly consistent with what Dr. Deal had described. Our sows were viremic day 3 and day 7. All of the sows were positive at least once, but at each time point there was only 4 or 5 here in day 3 and day 7. And then one sow was still PCR positive at day 14, but then was negative for the remainder of the study. As far as IFA, we used an IgG IFA with whole virus, and our sows, all sows were positive here at day 14. None were positive at day 7. As far as our fecal shedding, the feces were consistent between the first 1 to 2 weeks after inoculation, and the most virus was present at about 7 days post-inoculation. The shedding continued. We had a couple that were positive out to day 21, but then day 28 all were negative. Oral shedding, again, showing a very consistent positive in the first week post-inoculation, and then becomes variable and pretty spotty and weak positives here. There's one at day 14 sampling and then one at day 28 sampling, but the majority are positive here in the first week after inoculation. Now we're moving on to piglet sampling, or the data I showed was days post-inoculation. The rest of these will be days post-farrow. And so these are milk samples that were obtained when possible. It's a little bit difficult sometimes to get a sizable volume of milk out of sows that have a heavy piglet load. We did our best. So the takeaway here is very few. So 1 out of 5 litters, 1 out of 5 litters, and 1 out of 3 litters were PCR positive at that time, and very weak. So they're up here near our limit of detection for our PCR. And then none of the colostrum here had Senecavirus detected. This is the udder wipe. This was supposed to be a surrogate for our oral fluids, trying to compare whether or not you could have one sample be the same as what taking individual oral swabs would be. The results here, we've got 2 of 4 sows, 2 of 3 sows here at days 2 and 3 were positive, and then there's 1 each here at day 7 and 12. These are all very weak positives, and when we look at the oral fluid results here, more than likely, so here we've got, again, at 2 and 3, this may potentially be real, but it also may be environmental contamination because the udder is sitting on the crate floor. So that's something to kind of keep in mind, that this may not be truly oral fluid sampling. These are the oral fluid results. In the first 2 days post-farrow, we had detections in the oral swabs, but from day 3 onward, all were negative. Again, the same story, very few, 2 of 5, 2 of 5, 1 of 5, and all near the limited detection of our PCR. For fecal, we had 1 detection, or 2 litters were positive at day 2 post-farrow, but then the remainders were all negative. And so that begs the question, if we're hoping to infect piglets, why don't we have more shedding here? This is the serum results, and what this is showing, I would point out here, this is day 0, so this is when the piglets were born. We tried to catch before suckling. There were a couple when I think I went to get breakfast that may have snuck out. I don't know if that's this kind of oddball right here. None of the 56 were PCR positive in serum at day 0, and only one of those 56 had an IFA titer, and that was at greater than or equal to 1 to 80. We checked the IFA titer again at day 3, and of the 26 remaining piglets, all of those piglets were strongly positive on our IFA at greater than 1 to 320. So this would indicate that the piglets were not infected in utero, or at least weren't coming out with virus, and that there was no immune response to the virus, so likely they didn't see viral particles, viral proteins while in utero. And then these are all really strong titers here at day 3 before you would expect an exposure at the time of birth to have given an IgG response. Very strong, so suggestive of passive transfer from the sows. We'll move on to the lesions that we observed in our sows. So the first lesion was observed 4 days post-inoculation. It wasn't all that exciting. It just looked like an abrasion on the kind of the metacarpals, lateral metacarpals. Thought maybe she had hit it on a drinker, but we swabbed it anyways, and it was strongly positive CT17. To give you a frame of reference, the oral fluid and fecal for around that time frame was in the upper 20s, and so unlikely to have been just contamination from the environment. Then the next day, she developed on the contralateral metacarpal, almost the exact same lesion, but it looks more blanched here, and you can see there hasn't been kind of the rip. This looks like it could have just been torn. This is very clearly a developing vesicle, and then the next day it had a pretty ulcerated appearance. The same sow, day 8 post-inoculation, developed a coronary band lesion, pretty nasty looking here. And then to kind of give you an idea, as the lesion progresses, by day 10, all of that necrotic skin was gone, and you've got a nice bed of granulation tissue in there. This is our second sow to develop lesions. This occurred at 5 DPI. Here at the junction of the coronary band and sole, there's a blanched white area. And then the next day, much bigger, there's a little dot of vesicular fluid that's kind of oozing out of that vesicle. And then again, later on, this is another 2 days down the road, necrotic tissue is gone, and you've got a bed of granulation tissue there. This is the first sow that developed a vesicle on the snout, but that was day 6. She had developed a foot lesion here on day 5. Again, just kind of showing the progression. This is the second of the 2 sows that developed a snout lesion. This is at day 7, but again, this sow developed a foot lesion prior to. So the consistent theme is, at least for our study, was that the feet are affected, and all of these sows, I would show you here, here's another kind of foot and leg, distal leg, had lesions. On necropsy, none of the sows had gross lesions. As Dr. Gale pointed out, the tonsils were all positive, CT 21 to 29. The tissue homogenates, which would be kind of more of a typical field sample that somebody might send us, is a kind of a conglomeration of lymphoid tissue as well as highly vascularized systemic tissue. So lymph node, lung, spleen, heart, kidney, and a small piece of tonsil were again all positive, CT 23 to 29. For our piglets, each piglet was necropsied and then individually tested on their tissue homogenate and intestine. That's one thing I forgot to point out is clinically affected piglets in the field are all PCR positive on the intestine and multiple tissues. So these piglets, none of these were positive on their tissue homogenate. We had 2 piglets that were positive on the intestine. That was a 7 days post-Pharo and a 12 days post-Pharo. High CT values, very low amounts of virus. This is more than likely a pass-through effect from the environment because we don't have evidence of systemic infection in those piglets, but it's yet to be determined. We have ISH to perform on our tissues. So the conclusions here: all the infected sows did develop a short-lived viremia, about a week in duration. The skin lesions in these sows manifested first on the feet and then on the snout. Most of them occurred within 1 week of infection. They shed detectable amounts of virus in the oral fluids for a week and feces for 2 weeks. And shedding did occur in milk, but it was inconsistent. May have to do with the time of infection. These results don't support transplacental transmission to piglets, at least in sows that are infected between 14 and 21 days pre-Pharo. It seems very likely that passive transfer does occur of IgG to piglets through colostrum in those that are infected at least 2 to 3 weeks pre-Pharo. And our piglets did not become infected in utero by nursing or by environmental contamination or exposure. So I'd acknowledge the funding sources here: Minnesota Rapid Agricultural Response Fund, the SDEC, and then I've got numerous folks to thank here: VDL staff for all of their assistance in the testing, our RAR staff for the animal care that they provided, and then our cohort of swine graduate students, which were invaluable in helping me get the study completed.